have personally been impacted with Alzheimer's disease or another dementia, please join me in standing. This fight can be lonely, but it doesn't have to be. Thank you for standing with me. For those of you who are lucky enough to stay seated, thank you for recognizing that the impact of this disease reaches beyond the families it touches, and for caring enough to join us to learn more. Thank you so much. You may be seated. I'm pleased to welcome fellow committee member Jenna Sullivan.
Good morning. As Heather mentioned, my name is Jenna Sullivan, and I am a branch office administrator with Edward Jones in the Westville branch. Like so many of you, I stood a few minutes ago because I am the great-granddaughter, granddaughter, and daughter of women who have been affected by Alzheimer's or early onset dementia. My why for supporting this mission also includes our clients. At Edward Jones, we are in the business of helping families build and preserve their wealth. Alzheimer's disease is a great threat to the health and wealth of our clients. The unfortunate reality is Alzheimer's is a threat to all of our families' finances and futures. There are currently 6 million Americans living with Alzheimer's, and more than 11 million Americans, many of whom are our colleagues and clients, are providing unpaid care for them. Alzheimer's is one of the costliest diseases. The lifetime cost of care for a person living with dementia is over $390,000. With 10,000 seniors turning 65 every day, the incidence, caregiving, and economic impact is set to increase significantly in the future. At Edward Jones, we partner with the Alzheimer's Association and participate in the Walk to End Alzheimer's because we refuse to stand idly and watch this disease destroy the financial security and future hopes and dreams of the families that we serve. We walk to raise awareness and financial support to accelerate the day when we find a cure for Alzheimer's. Annually, Edward Jones Associates and their clients from across the country unite to support the Walk to End Alzheimer's. We engage our new clients by simply extending an invitation to join our local walks in our teams, and the response is remarkable. By a show of hands, who in this room cares about customer satisfaction? At Edward Jones, we measure customer satisfaction and loyalty with a metric called the Net Promoter Score. Recently, we surveyed our clients and they participated in the Walk to End Alzheimer's event and measured this NPS. The research shows that as an activity, a client's attendance at a walk is higher than 14 NPS points. Here today to tell you is how the association is leading the fight to end the disease is Julie Moore, our Senior Director of the Walk to End, the Walk of Alzheimer's Association, Greater Indiana Chapter. I need one more cup of coffee, y'all.
Everyone, and thanks so much for bearing with us. As Jenna mentioned, my name is Julie Moore, and I'm the Senior Director of Walk to End Alzheimer's for the Greater Indiana Chapter. So I have the honor of working alongside Heather here in Northwest Indiana, as well as 4 other walk managers throughout Greater Indiana to host 13 walks throughout our chapter. If you've ever met an Alzheimer's Association staffer, they've probably asked you your connection or your why. And my why for supporting this mission is because I am one of 5 children, but I am my mom's person. So some of you can probably relate if you have siblings, right? Even when there's a lot of siblings, there's usually 1 or 2 that kind of rise up as that person for your parent. And so I'm fortunate that my mom is pretty able-bodied, and right now the caregiving is limited, but it's still a strain, right? Making sure that she gets to doctor's appointments and the grocery store. So as a working mother and having 3 children and just a lot on my plate, it is a challenge. So I am so passionate about the work that we do to wrap our arms around caregivers. And so, of course, it isn't without saying, so many of you stood so clearly the impact of this disease on families and on communities is immense. But perhaps you'll also realize the impact on businesses. So I'm going to tell you a little bit about that today. First, I want to talk to you a little bit about who is the Alzheimer's Association and what do we do. Ultimately, we are pursuing the end of Alzheimer's through advancing research, driving risk reduction, and supporting brain health. And until that day, when a cure comes, we are wrapping our arms around families and communities that need us by maximizing quality care and support. And again, our vision is ultimately a world without Alzheimer's and all other dementia. And how do we do that? So the association does that in a variety of ways, including by providing support groups, education programs, and other activities to help people navigate the disease, all completely supported by donations made through the Walk to End Alzheimer's and other Alzheimer's Association events. The Alzheimer's Association has also made funding research a priority in order to slow and one day stop the disease. The association has granted over $167 million to more than 500 leading international research projects working towards methods of treatment and prevention. And today we have over $320 million in active research happening. The Alzheimer's Association is also a leading voice for advocacy, fighting for critical research and care initiatives at the state and the federal level. As an organization, we may only reach a portion of those impacted in local communities with our services, but through advocacy and legislative efforts, we can reach 100%. So how? We can connect volunteer advocates to policymakers who can make a difference. And for those of us, or for those of you that have been working with the association or have been in contact with us, you likely are aware that we've entered a new era of this disease. We are in the era of treatment. So as of June 21st, we had our first FDA-approved treatment for the underlying biology of Alzheimer's disease. And since that time, there has been a second treatment on the market. So we are very energized by this. If you talk to researchers in the space, this is the golden age of research for this disease. And so treatments are within our reach. I will say that the current treatments on the market are for those in the earliest stages of the disease. However, it is the first pebble, and we know that the ripples will grow from there. So we are really energized and excited about that. And that's part of our main federal legislative priority right now. Centers for Medicare and Medicaid Services are not yet covering these new treatments in an unprecedented move. There's not been another disease state that have faced obstacles like that. So we are making our voices be heard and letting them know that that is unacceptable. As of this week, we did learn that CMS has agreed to cover lecanemab, the second approved treatment, as soon as it receives full approval from FDA. It went through an accelerated approval process, which is set to happen in July. However, there are some buts with that. There's a registry process and just, again, other roadblocks that are unprecedented. And so that is how we are making our voices heard at the federal level. And at the state level this year, we were really excited to be able to support and rally around getting funding for 15 dementia care coordinators placed in area agencies on aging throughout the state, and we were able to get that passed. So providing local support, additional local support in the community. So we're really excited about that. But again, we talked about that Alzheimer's takes a big toll on people worldwide, including your employees. It's important to remember Alzheimer's is not just an elderly person's disease. It affects all ages and is a family and community issue. Did you know that 25% of caregivers are in the sandwich generation, which means that they're caring for a parent with Alzheimer's or dementia and raising children under the age of 18? And 18.5 billion hours of unpaid caregiving is valued at over $234 billion. And as Jenna spoke to, financially devastating, Alzheimer's is one of the most expensive diseases in the U.S. and by 2050, it could cost the nation as much as $1.1 trillion. So some of you may or may not realize, as we talked about a little bit, that employees are also caregivers, which means your companies are impacted by this disease. You can see here on the screen that folks are having to take off early, retire early, step away from the workforce altogether, and in a stage of society where workforce development is already a big challenge, Alzheimer's further threatens that. And so we're here to share today a little bit about how you can wrap your arms around your employees and clients that are impacted by this disease. And then on the next slide, you can also see the toll that dementia caregiving is really taking. So 57% of folks had to take off time or leave early, compared to 47% with other disease states and other types of caregiving. So purple represents those caring with someone with Alzheimer's and dementia, and teal represents those for other disease states. So again, this is a real issue and is coming for us whether we know it or not. So based on the information shared today, you may be thinking, what can I do to help? What can I do to help employees, co-workers, clients? Well, here I wanted to provide some supportive resources. So if you write nothing else down today, and actually you don't have to, it's on the pad in front of you and in your folders, we have a 24/7 helpline. And when I say 24/7, I mean 24/7. You can call it 7 p.m. on Christmas Day and you will reach a live person on the other end of the phone. Trained professionals that are there to help you with your questions. There are also licensed social workers on every single shift. So a lot of times we know that people will take this information and hold it tight because they're just kind of frozen, paralyzed, and call in their most urgent times of need. And so those licensed social workers are there to help navigate some of those really critical points with your loved one. We also have bilingual staff and a translation service in over 200 languages. So please don't minimize the incredible resource that this is, and it is not an operator, it is not a computer on the other end, it is a live person. In addition, we have local support groups. We have support groups in all 3 of the Northwest Indiana counties, I know there's more than 3 in Northwest Indiana, but we have a number of support groups up here, all led by incredibly trained volunteers. We offer education programs, both online and in person. So those education programs can be accessed around the clock at training.alz.org. And those are, there are general education programs such as Know the 10 Signs, but there's also really specific education programs for family members such as effective communication with your loved one. And then the online resources are immense. alz.org is just an incredible repository of support. So included in there is our community resource finder, which is an online directory of services for those navigating Alzheimer's and dementia. So for those of you here today representing senior services, elder law attorneys, relocation services, anything that you can think of that a family in need might need, I encourage you to go to alz.org/CRF. See if you have a profile listed and make sure it's up to date, because this is a comprehensive repository. In addition, we have Alz Connected, which is like an online support group, an online message board for both caregivers and folks in the earliest stages of the disease to be able to connect with others. And then Alz Navigator is an online care planning tool as well. And so I want to leave you with that the Alzheimer's Association is always here around the clock through that 24/7 helpline, through the website, and of course we have incredible on-site representation as well through Heather. And I want to take the opportunity to also introduce Patty, who is our programs director for the Alzheimer's Association. She's here today but doesn't have a speaking role, so wanted to be sure to introduce Patty. Patty leads our programs for the Greater Indiana chapter. How are we able to do all of this? We are able to do it through local support, right, nationwide through, and Walk to End Alzheimer's is one of those premier funding sources for our work. And so here to talk to you a little bit today about the Walk to End Alzheimer's is Heather.
So all of the great information that Julie just provided, I want to let you know in your folders is our care and support brochure, and it has all those different links to research, for advocacy, for WALK, for the community resource finder. So this is really a great tool that has all of those resources that she provided. Again, I'm the development manager and the Northwest Indiana WALK manager for 3 WALKs that we have. And for many of you, this might be the first time hearing about WALK to End Alzheimer's. This event takes place not only in our own communities, but in communities across the nation. WALK to End Alzheimer's, the signature event for Alzheimer's Association, plays a significant role in helping the association advance its mission, as Julia spoke about. And it's really because of people like you who can help spread the word and be active at our WALKs. In Northwest Indiana, we're fortunate to offer 3 WALKs in our communities. So we have a WALK on September 10th in Lake County, Wicker Memorial Park. And that's on the Sunday. Valparaiso for Porter County, we have it on October 1st, and that also is a Sunday. And then on a Saturday in Michigan City in LaPorte County, it's held at Washington Park out in Michigan City. So we want to give a special thanks to Edward Jones as our national presenting sponsor and highlight our generous sponsors who are walking alongside us and are determined to end Alzheimer's. We want to say thank you to Hard Rock Casino of Northern Indiana, Dr. Leonard Inglis Implant Dentistry, Centier Bank, Community Healthcare System, Horizon Bank, and Urschel Laboratories, and Trilogy Health Services. And of course, there are still opportunities available for your company to be added to this list, and love to have you invest. As when you invest in WALK, you're investing as a partner to help us create more hope and longer lasting memories with our loved ones and loved ones of your families, for all of you who have stood and are speaking a voice for your loved ones. By sponsoring your WALK, your company can advance your corporate social responsibility, gain brand visibility, and improve employee morale. Sponsorship will close the end of June, so we'd love to be able to talk to you further about it. There is information in your packets as well, and you are able to align with all 3 of our WALKs. So partnering with WALK as a company team is another area where you can partake and show your support. And it brings really an opportunity to bring your colleagues together in the fight against Alzheimer's. It's really a turnkey team building activity for your employees, all while helping those that are affected with the disease. It allows your employees to build camaraderie, whether they work in the office or they are virtual. It gives an opportunity to plan fundraising events or even have some friendly competition among your different departments or your teams that you have, or even different branches if you're spread across all different counties. So participating as a company team demonstrates the shared values of your company, between your companies and Alzheimer's Association, of course, of striving for excellence, having brand integrity, showing as industry leaders, and really servicing your clients, focusing on giving back to communities, which all of your companies are looking to do. I'm honored next then to talk more about WALK from first-hand experience from a company point of view is Nicole Birmingham from Centier Bank.
Thank you so much, Heather. My name is Nicole Birmingham, and I'm the branch manager of the South Lake location. That's right in the Sam's Club in Maryville. We have been a sponsor for the WALK, and every single year that we've gotten involved, we've gotten one step deeper. And we now have three people from Centier Bank that's on the committee. We take part in the 3 WALKs. We get exposure for our sponsorship, where it's not about the exposure, but we have a booth where we could just give giveaways, just meet people, and it's wonderful. I keep coming back every year. Not only is Centier a proud sponsor of the Northwest Indiana WALKs, but our associates, they've become a part of the walks. We have our walk teams. I actually lead the Lake County walk. It's a lot of work, but it's a lot of fun. We have all kinds of ways to fundraise. The Alzheimer's Association, they actually provide these little flowers here. We sell them at the branches. We ask for change. We sell these for $1. We have bake sales. We have contests. One year we had a pizza party incentive to whoever, the branch that raised the most money. I think this last year we did Starbucks, but the employees love doing it. And we, every year, our turnout for the walk itself, there's more and more employees every year. We have about 1,000 employees at Center Bank, and so many have loved ones that they've cared for or they've lost, and it's really hit close to us. And we have clients. I have clients that I work with that I've lost personally, and it's so hard to see the families struggling, to see the clients just kind of diminish. So this hits very close to home for us, and so that is why we want to do whatever we can. The Alzheimer's Association, they're amazing. Julie shared so much information, and there's so much more. And the Alzheimer's Association, they even have had Zoom calls with Center. It was during COVID, but they have reached out to Centere, and they educated the employees on signs. They had an open forum where we could just ask questions and just get more information. So they're willing to do whatever they can for your company. They're an outstanding resource, and Centere absolutely loves partnering with them. And again, we just keep growing with them because they do wonderful things. And as far as tools, participating in the walk and fundraising, they already have it all planned out for you. Like I said, we've got these flowers. They give little stickers for people to raise money for a casual for a cause day. Have the employees donate to raise money in that way. They have a portal where with your walk team you can customize your own page and you can share that through social media. It's so easy. You could put pictures of your team on there, and everyone can individually, share with their family and friends. And it's awesome. And one of my favorite things, they also have a mobile app. But while we raise money, when people give checks, the mobile app, you can take a picture of the front and the back of the check, and it goes straight to the Alzheimer's Association. It's awesome. So it's so easy. We love being a part of it, and I think you guys should do it too, because we just keep getting more and more involved. So with that being said, it's my pleasure to introduce a decade-long walk supporter, Lynn Lever.
I'm hoping I can do this without my glasses and read my notes. So thank you so much for being here. It means a lot to the organization for all of you to be here showing your support. It's important to learn about Alzheimer's, the Alzheimer's Association, and how you can help raise funds to consider their amazing effort. As you've seen here today, and for too many of you who have experienced this in your own life, this is a complicated and extremely cruel disease. My journey began when my mother was diagnosed in 2012 with Alzheimer's, and 5 years later, we lost her. But my journey has continued through helping colleagues, friends, go through their journey. I've reached out to people and just expressed my support, shared my advice, and have continued to walk for the organization raising much needed funds. When you first hear about Alzheimer's, what do you think? Memory loss. That's what I thought. My mom's gonna forget me. This was extremely difficult for me as I live 1,000 miles away from my parents. They live in Massachusetts. After every visit, I wondered, was this gonna be the last time my mom remembered me? But Alzheimer's is so much more than memory loss. I never dreamed what the effect of Alzheimer's has, not only on the person diagnosed, but also to the family. My mom was a beautiful, vibrant person, and she became a shell of a person. She lost everything that she loved. She slowly declined. The only two things that my mom didn't lose happiness was her family and her manners. In the last year, of her life, my dad unfortunately had to put my mom into a home. He could no longer care for her in the way that she needed to be cared for. It became harder and harder for him. So my mom's manners continued till the day she died. She thanked people for changing her undergarments. So, of the two things that she remained to the very end was her love of her family and her manners. My family made 3 commitments during this period of time: to keep my mom's dignity, to keep her home at home as long as we could. I'm sorry. And that my 2 siblings and I would not have this disease tear our family apart. My dad cared for my mom for the last year of her life. He learned to cook, do laundry, and give loving care to the love of his life. All these things a man in his 70s is not ready to do, but he did them. It wasn't easy. Housekeepers were hired. Caregivers started to come. My brother and sister, who lived locally, pitched in, and I would come for weeks at a time to give my dad a much-needed break. And this is where, as employers, you make an incredible difference in the lives of your employees. I am grateful beyond belief to my employer for supporting me, giving me the time off. I worked remotely. They were amazing. And to this day, they continue to support my walk, both financially and emotionally. My colleagues and bosses have been amazing. So I encourage you as employers to make that a priority for anyone suffering in this situation. My family was lucky. We all worked together to achieve the commitments we had made. Others are not as lucky to have the support that my family internally had. And this is where the Alzheimer's organization excels. They are a tremendous asset. During this time, I've made friends. I've continued to make friends locally. And they have helped me with giving me advice, which has been invaluable. Sometimes they've just listened to me. And that is so important, to just be heard. As a caregiver, you spend each day trying to survive and get through the day. There's no other way of doing this because you just have to get to the next day. You have no idea 1 minute to the next what is going to happen. It is an ever-changing situation with the person that's been diagnosed. When you're a caregiver, getting help and caring yourself needs to be of paramount importance. It is hugely important. We felt as a family we were going to lose my dad before we ever lost my mom. And we tried to support my dad as much as possible, but sometimes people just want to dig in and do it themselves. Again, the resources for caregiving is huge. Alzheimer's is not, the association is not just about the person diagnosed with Alzheimer's. It's about your whole family unit. It's about caring for everyone, finding the resources, what you need to do, listening to you. So it's just so valuable. We know this disease is complicating, but raising funds is so super easy, as Nicole said. It is so easy. I participated in the Walk to End Alzheimer's for 12 years. I made a promise to my mother that I would walk until a cure is found. I'm tired of walking. I'm tired of raising funds. I want to be done. I want Alzheimer's out of my life. But it's a promise that I've made that I will keep and keep doing until we raise what we call at the walk a white flower, because a cure has been found. I want to live to see the white flower raised. So the walk is a great way for you to participate with your colleagues, your friends and family to help against this disease. I've had people walking with me for 12 years. My son walks with me. We walk in the LaPorte County Walk. It's along the water. We draw a heart and take pictures of a heart for my mom every year. And it's a great opportunity to just get out into some fresh air. So I invite all of you to join me in LaPorte on October 7th to walk. If you want to join Team Hope, you're welcome to join my Team Hope, or better yet, start your own team with your own friends. Also, if you can, and you can't make the LaPorte County Walk, the Porter County Walk and the Lake County Walk on October 1st and September 10th are available. So get your walk on, people. Help me retire from this. Thank you so much.
That's the ask. We're inviting you all to join us in this fight by registering your free walk team, by providing an on-ramp to your colleagues, to your friends, to your church family, to those you don't know yet, to join this mission. So it's free to register, and so we are going to ask you to do that at this time. In your folders is a registration form that you can fill out, and we can get that entered and follow up. You can also scan the QR code here if you'd rather do it electronically. So we're gonna take a few minutes and let you all think through that, complete your forms, and then we will come back and wrap up. Thank you. He said, do things here and now, not after you're gone. If you have some money, share it. And if you have some time, do something worthwhile. So we want to thank you all so much for investing an hour of your time with us this morning, for learning, for taking what you've learned back to your colleagues, your clients, people that you may not have even met yet that need you. So thank you so much. Heather and I will be in touch following up. This isn't okay, we've signed up, now what? We will be there with you the whole all along the way and figure out what's important to you and your company and how we can best support you. So today is step one, and we will look forward to continuing in the journey. I do want to take just a moment, since we have a few minutes left, to see if there are any questions for the good of the group. All right. Well, thank you again so much. Feel free to stick around for a few more minutes and network. And thank you again for joining us.